Okay, so we're good to go?
You want to start?
Okay.
Did you want me to introduce you since you're speaking first?
Yes,
or introduce
please,
you?
if you would.
Okay, sure. Yeah.
I think the camera's on.
Oh, okay.
But if you would prefer, I can text questions to you. These are the social media cards.
This hand is the card, yeah.
Hello, everyone. Thank you for coming. My name is Jessica Alexander. I am the VP of Digital Engagement with Staff Assembly. Hello to all of you who are watching our live stream. Thank you for joining us. We do have an Instagram story question posted, so if you're following along on live stream, feel free to post any questions you may have that we can have our panel answer for you, and we'll be monitoring that throughout the session, and we'll save those for the Q&A portion at the end. So I'd like to go ahead and pass it off to Luby Levin to go ahead and start us off with this panel for more information on the university's preparedness for the coronavirus.
Good afternoon, everyone. Thank you, Jessica, very much. Jessica is part of our Staff Assembly team, and I want to express my appreciation to the Staff Assembly for co-hosting this program with us. Obviously, this is a very important one, and we appreciate all of you taking the time, either who are here today with us or remotely, to be part of our discussion regarding the COVID-19 situation. I also want to give special thanks to our campus senior leadership. They have established a very strong commitment to ensuring the safety of all of our students as well as staff and faculty. And I think safety and health in this very quickly moving environment is critical to all of us. We hope this session will be helpful to you. We plan to share all the information that we have, and as changes take place, we will also continue to post information on the web, to have additional FAQs available to everyone, and to work with all of the departments across the campus to make sure people have the information they need. This session is very timely. As you all know by now, Chancellor Block issued a message yesterday indicating that for students, classes will be moved to an online learning approach. And I've heard, as of today, there are faculty who have already delivered classes in that fashion, and so far, what I've heard is that they're going very well. We want to make sure you're aware that the campus is continuing to be open, that we want to make sure departments are providing continuity, and there are lots of questions and the possibility that things will change over time. But we want to assure you that any questions you have will be very well received, and we'll do our best to answer those questions, both today and for the next several weeks and on an ongoing basis. We're planning to cover some key information with our Administrative Vice Chancellor, Michael Beck, who took time out of his very busy schedule today to be here with us and to share the planning and preparation activities that are going on for the campus. Additionally, I want to thank Professor Bob Kim Farley, who also took time out of his teaching schedule to be with us today to go over some of the health-related issues and make sure we are all well informed. And finally, we have members of our Campus Human Resources team, our Employee and Labor Relations group, Director Anthony Solana, as well as Emily Tunteri, who's going to brief you on policy issues and the most recent guidance we've received from the Office of the President on issues such as administrative leave, other leave opportunities, telecommuting, and so forth. And I wanted to mention we also have with us today, and they're available if questions come up, our co-directors of the Staff and Faculty Counseling Center, who are available to support all employees' needs, whether it be health-related concerns, other events that cause stress or anxiety, and I want to make sure you have the resources available to use their services as you desire. So let me turn the program over to Vice Chancellor Michael Beck to begin our discussion with you. Thank you.
Thank you, Luby, and thank you for everybody that is online and in the room. This is, of course, a difficult issue for the campus to go through, but it is something that all of us are confident we will be able to get through successfully and continue to manage. And I appreciate all of the students, faculty, and staff, their cooperation with this. It's a very fluid incident that will continue to be fluid and, in fact, will increase in severity before it starts to decline. So I'm going to go through just real quickly, just a quick summary of how we got to where we are today, starting with just really the beginning of COVID. And it started in December 31st of 2019 in China, where they saw a significant cluster of cases of acute respiratory illness. And then in January on the 7th, they actually confirmed that they had a novel coronavirus was associated with the outbreak. The first case in the United States occurred in January 19th, and there was a significant movement in Wuhan to limit the movement of individuals in and out on January 23rd. The first case in LA County was January 26th. I missed the first case in LA County was January 26th. And by January 30th, basically just about a month, there was already 7,700 confirmed cases with 170 deaths in China and 83 cases in 18 countries around the world. So the World Health Organization declared a public health emergency of international concern. And then get us to where we are today on March 11th, the World Health Organization actually formally declared that the coronavirus or COVID-19 is actually a pandemic. So this is something that we've been tracking in our emergency management coordination. Gives you really slides for what's happening in the United States, California, LA County, and then UCLA. The zeros are UCLA, and so that's the good news, that we still, even as of 1 o'clock today, we still have no confirmed cases on our campus. But you can see how quickly this grows from early January 26th up until today, 3/11, going from two cases in the United States to 1,117 cases in the United States, and from 1 case in LA County to 27 cases in LA County. And in fact, we had developed this PowerPoint earlier today and actually had to modify it at 2 o'clock because this is obviously very constantly evolving and more data. And so this is, for those of you who haven't seen it, this is a great site that many people, both in the media and emergency managers or others, are using, which is a way to confirm what's happening across the world. And this was taken earlier this morning at 121,564 cases, which I'm confident are higher now. That's occurring throughout the entire world, with 4,373 deaths. And what you're seeing in the middle is the map of the concentration. It's identify where the concentration is occurring, and you can see that most of the concentration is in Southeast Asia and in Europe, and then starting to build actually in North America. So what are the symptoms? The symptoms generally tend to be fever, cough, fatigue, shortness of breath, and then the symptoms actually can potentially worsen during the duration of your illness. One of the things that's also important to know is that scientists and health professionals actually know, actually even today, they're learning every day, but know very little about the COVID-19. And so a lot of the theory or advice that we're getting is based on other coronaviruses like SARS and MERS. And so that's an important part, is that the fact that even what we know about the COVID-19 is evolving as we see it today. And so the way in which it's transmitted to individuals is through respiratory droplets. So that's either somebody sneezing or coughing on you, or somebody that's wiped their face, secretion, and then potentially shaken your hand or touched a surface, and then you've touched your face, and therefore that's the predominant way in which that it's transmitted. One thing that's important is that today they still don't believe that it is transferred via airborne transmission, meaning which is not making its way through a traditional air conditioning system. But I would, again, these are still things that we're learning. And that the evidence is that routine environmental cleaning and disinfectant is actually very effective. So real quickly on the sort of UCLA response, and we'd be here all day if I talked about all the things that UCLA has done to prepare and response to what is now a pandemic. But I want to just share some of the highlights to know that really since early January, we've been actually dusting off our pandemic plans and going through it and identifying how in which this particular incident would compare to what our existing planning would undertake. And then incredible coordination with the CDC, California Department of Public Health, LA County Department of Public Health. When you have one of the world's greatest health systems literally on our campus, it's an enormous benefit, and we have wonderful cooperation from them, as well as our UCLA faculty from the School of Public Health and across the campus and the School of Medicine, and also from our sister campuses in the UC system and our friends at USC. We're actually in daily conversations to identify what's happening on their campus, what are their communications, what are the issues that they're seeing, so that we can try and anticipate and support each other to try and implement best practices. So they've set up screenings at both UCLA Health and the Ash Student Health Wellness Center, and in fact there's a drive-through screening that UCLA Health is set up for today, so they can screen people that are concerned about their illness, because generally we don't want individuals with these symptoms to actually walk into the ER, because they potentially could infect people that have more serious ailments. And then preparing this for student isolation or quarantine, meaning which we identify facilities that if we end up with students that need to be isolated or put in quarantine, we have facilities that we can quickly move them into and have sufficient number to be able to accommodate students. And then if individual facilities don't become adequate, then we have a mass quarantine facility plan, and that was reviewed and updated. And then significant increase in restroom cleaning, cleaning of the dining facilities or other high traffic or high touch areas with antibacterial or antiviral chemical solutions to make sure that we're trying to prevent the spread from individuals touching common surfaces. We ended up deploying hand sanitizers across the campus and on Bruin buses and other places. Many of you activated their operations plan and opened their command center to make sure that they're handling the significant increase in demand. The emergency management planning group is actually meeting daily and dealing with policy and planning issues, both dealing with what needs to occur today, and then also trying to anticipate how we continue to operate the campus going forward. Significant communications efforts through strategic communications. You've seen 13 Bruin posts. I say plus because I know we're working on more for today, so at the moment there may have been more, but it's 13 Bruin posts. There's also significant amount of resources available on BSO, the Bruin Safe Online website, which is where we want everybody to go for emergency information, but there's also significant resources, including FAQs and other information that might be helpful. And then strategic communications also set up a specific landing page at the newsroom specifically dedicated to COVID-19 so that people can get information from there as well that's in a little bit, I would say, sort of a softer form than how we push data in under emergency management. And then student forums have been held, multiple student forums by Student Affairs, again, trying to reach out to students, identify what their concerns are, and also communicate what's happening in regard to response and what our planning is. And then today is our first staff forum, but our intent is to continue these in a way in which is helpful. So give us some feedback on that at the end of this session. Let us know if this is helpful and we can do more. Business continuity planning is a significant issue. And I say the campus cannot close because we are more than, we're not like an elementary school or a high school where you could lock the doors and everybody walks away. Even though we don't have class, we're going to move to classes online, we still have graduate students living in facilities. We still have students that that live internationally, may not be able to go home. We have students that call UCLA home. That may be where their permanent residence is while they were here. So we still anticipate serving tens of thousands of students and our community. So the campus is absolutely closed. We also have significant research projects, including a research project that was announced earlier today looking for vaccines for COVID-19 that is happening on the campus. So not only are we planning for the emergency that we're dealing with, but we're also directly involved in trying to find solutions. So when I say the campus can't close, it's just not possible to close the campus. So we have to think about how do we continue to operate the campus and be able to serve the immense needs that exist on the campus, and recognizing the fact that the students are still learning. They may be in a distance learning, and this is a new format. And so again, that level of support is even more significant. And then academic continuity. We put together an academic continuity task force. We put together a plan that's been online. We acquired additional online learning software licenses, laptops, iPads, hotspots, and a number of other efforts to support the online moving. When you think about what's happening, we have thousands of classes that are occurring within our quarter, and all of those literally within less than 24 hours are going to an online learning environment is very significant. And for many individuals, faculty who hadn't anticipated that and have very comfortable with their classroom and teaching model are now forced to look at ways in which they can continue to be effective in their teaching in this new modality. Big goal was to actually reduce the density of the campus to protect the community. So when we talk about a community spread, or we talk about spreading of the disease, it spreads more quickly in denser environments. And we know that we have over 80% of our students living in the Hill that are in triples and very tight conditions. And so part of our initial plans was really to reduce that density, reduce the density across the campus, recognizing the fact that we still have to operate, but that reduces the risk for everybody else who needs to be here, either as a student or as a faculty or staff member. And then faculty training and support systems in an effort to make sure that we can support the faculty in this new modality. And also suspend events for over 100 participants, for any event over 100 participants. And we're in the process of sort of a glide path into that. We didn't declare that immediately because some events were already occurring. We had individuals for performing arts activities that were actually literally on planes coming here, audiences that had already purchased tickets. But the intent is that all events over 100 will no longer occur on campus, and that includes athletic events. And so we were one of the first campuses to do that. And that's primarily because of the fact of this goal, again, to reduce density. It didn't make sense for us to send our students home and then have 11,000 people come or 13,000 people to come for a basketball game. And so we really appreciate the cooperations with our colleagues in athletics. And then research continuity. We talked about the fact that we're an enormous research enterprise, and that is currently ongoing to figure out how do we continue to support the research operations of the campus and the animals associated with that, and and make sure that the laboratories continue to be safe in case somebody becomes sick overnight and isn't able to return back to the laboratory. So what are some of the significant impacts that are happening to the campus? Certainly challenges with transitioning to online teaching, learning, and testing. We're going to work hard to do our best, but this is not going to be perfect, right? I think this is something that is going to evolve, and we need to have the campus be able to be supportive and understanding that this is where we need to go at the moment, but also recognize it's not going to be a perfect transition, and so we need to do whatever we can to be flexible there. Heavily impacted health system. The health system in the United States, in particular in LA, is heavily impacted or overloaded. Ronald Reagan is over 100% census almost every day before COVID. And so this is really important when we get to talk about some of the issues that Professor Kim Farley is going to talk about. Is part of the goal is to flatten out the curve associated with spread to enable our health systems to be able to support the individuals that become seriously ill as a result of this. And then supporting students remotely. This is going to be a new challenge for us. We don't regularly do this, and so this is something that we're going to have to get comfortable with and identify ways in which we can do that effectively. Outreach programs have been curtailed in some fashion, and they'll continue to be curtailed, and this may impact future enrollments at UCLA. We have to be honest about what that might be when you can't go out and have be able to communicate about what's wonderful about UCLA and the advantages of students being able to come here. And then we could see a reduced operating income from canceled departmental programs or events, and certainly higher operating costs as we undertake these new challenges. General community concerns and fears, I think we see that both on television and I think within our own offices and within our own work environment. We're likely to see staffing issues resulting from the increased absences due to the fact that we might see higher employee illnesses, a potential for local school closures that impact families with small children, and with fewer student employees. We have thousands of student employees that are here under work study or otherwise and provide a great value to the campus. And if they're not, all of them are going to be here, again, it'll put more pressure ultimately on the campus. And the reason I say that this is really important when we look at the concept of some of the things that we've talked about in our communications about telecommuting and why are we continuing to have staff come to the campus. And the reality of that is that this is the time we really need an all hands on deck environment. The staff are absolutely critical to be here to be able to continue to support. There are certainly some employees that already have telecommuting options as people get sick or might have other issues that we'll hear about later associated with the policy associated with how to deal with leave associated with COVID. We may need to look at being more flexible associated with telecommuting, but at the moment, we don't see a significant aggressive telecommuting plan being implemented for the campus. We will continue to reevaluate that, but at the moment, like I said, it's an all hands on deck function for the campus. So ultimately, what can you do as individuals? They say the number one thing we can do from the health professionals say the number one thing is wash your hands regularly and thoroughly. Cough and sneeze into one's sleeve or into a napkin or tissue and throw that away. Stay up to date on your immunizations and flu shots. We're finding a significant number of folks. Remember, we're still in flu season, and so we're seeing individuals that are getting the flu and believing that they might have COVID-19, and that's, again, creating additional stress, but also putting additional stress on the health system. So if you're up to date with your flu shots and other immunizations, you can protect yourself from catching flu or other ailments that might make you sick. If you are sick, and I can't say this more strongly, if you are sick, do not come to work. Do not come to work. Do not send your children to school if they are sick. It is important that they get well and they stay isolated when they are ill. Anticipate transitions will not be smooth over the next couple of weeks and maybe even over the next month. Be flexible about the changing conditions and potentially changing messaging. Everybody's doing the best that they can and recognize we're trying to pave the way, certainly with the best information we have. And stay informed. Use Bruin Post as a good way to get campus information, BSO, the COVID website, and find other reliable sources. And I say that sort of deliberately because there's a number of sources, as we know, that people take advantage of incidents. And if you look at some social media sites and everything, don't necessarily believe everything you're reading. Try and make sure that you can validate what's happening before you create some fear to yourselves or others. Limit international and domestic travel. We're likely to come out with a message soon that strongly urges, if not prohibits, international and domestic travel for UCLA business. So that hasn't happened yet, but I think you can anticipate it as a way to reduce the contacts that you might have by going out and potentially getting sick or catching COVID somewhere else and bringing it back to California, back to UCLA. Avoid large assemblies. So that's avoid, this would not be the best time, I would say, to go to Coachella, which is why I think they've canceled it, although that demographic at Coachella is probably actually pretty safe. And then develop departmental business continuity plans. This is really important. So we have campus continuity plans. Each of the departments should have continuity plans. Revisit it. Identify who's going to be able to handle and manage the departmental needs if, in fact, somebody in your department or you yourself become sick. And we've been asking this question to faculty. When you think about it, who do they have if a faculty member becomes sick that can teach their class? This is something new that we have to contemplate, and they may not even be sick themselves, but they may have come in contact with somebody who did become sick with COVID, and now they're in 14 days of isolation. So online teaching will facilitate that because they'll still be able to teach from the comfort of their home, but that's something that we need to look at as we continue to operate business. And then look at personal continuity plans. What do you have in case you become sick or somebody in your family becomes sick? Do you have plans to be able to support them? Or if schools close, what are the plans that you have to be able to support that? Are you going to the, when you go to the market every day, are you picking up maybe a little bit more spaghetti or other things that will sit on the shelf a little longer, anticipating that if you were not able to go shopping for 14 days, would you have sufficient food to be able to support yourself? And these are the things that we want you to contemplate as you go forward. So with that, I'm going to turn over to Professor Robert Kim Farley. Thank him for participating. He's a professor in residence in the Fielding School of Public Health and has been a great partner with us, understanding the immunology aspects of all of this. So thank you. And
pleasure. Thank you very much, and I greet all of you. I think this is going to be the new era of non-contact greetings that we need to be implementing. The handshake should be going out. Maybe all of us here and online can begin to practice as ambassadors from UCLA some of the practices that we need to do. And I don't think really necessarily the fist bump after maybe someone's wiped their nose, or the coughing into the sleeve, then doing the elbow bump is necessarily going to be as good as some other non-contact method. I want to especially thank Michael Beck for inviting myself, representing the Fielding School of Public Health. We really are wanting to be a very good partner and citizen of the campus. And I can certainly mention to you that in my service that I'm on the COVID-19 task force here campus-wide, people are working very, very hard together, very good cooperative atmosphere, and we're all trying to figure out what we can do to make sure that staff, faculty, and students are being supported. I thought I would start off just real quickly on some slides that just kind of gives you an idea about the fact that really, for most people, COVID-19 is a very mild illness. 80% of illnesses are mild in nature, and probably many more than we have is asymptomatic entirely, with not even knowing that you had the disease. However, there is about 14% who do require hospitalization, and some then require intensive critical care. I want to mention that there is also, we need to always keep looking at what is the glass half full side of things, and to realize that right now there are more people recovered from COVID-19 than are currently ill with COVID-19. So I think that's something to realize. There is life after COVID-19. So we move into a recovery phases as well in our preparedness plans. I also want to note that, again, there is the demographic, as Michael alluded to, that primarily people that are under 50 years of age, the fatality rates are actually quite low, can be order of magnitude lower than for people who are, for example, over 80, where it can be 15%. So I think that's important to realize. And also, I want to emphasize that when you talk about case fatality rates, that takes two numbers. How many people die, and you divide that by how many cases that you have. The problem we have right now is that the actual number of known cases may actually be underreported. People have very mild illness. They may not have even gone to a medical care facility. So it's a much bigger number than probably actually exists. And you'll see, if we look at that in Korea, for example, there's a lot lower case fatality rate, mainly because of the fact that they've done so much aggressive testing and have picked up so many cases. There's also the understanding that a number we don't typically see too much being used is infectivity to deaths. So a infectivity to fatality ratio. And if you think about that, what means that even as I mentioned, the actual case fatality from people who are known cases is probably lower than what's being reported. The infection to mortality rate, that's at all other people below the radar of having any symptoms, but actually have had infection. We won't know about that until we do some serosurveys and things like that. But it would be my impression that we would actually see even further lower number by, again, maybe an order of magnitude of the fatality to infection ratio. So those, again, not only who are older, but you also have the situation of those who have pre-existing medical conditions. And especially sensitive to that are those who have cardiovascular disease, diabetes, and chronic respiratory conditions like, COPD and things like that. So these are the folks that are particularly at risk. 80% of those who have died are over 60 years of age, and 75% of those who have died have had coexisting medical conditions. So how contagious is it? Well, it is contagious, but it is on a spectrum of things. As you can see here, that something like measles is a much more highly contagious disease, and it's an airborne spread, which means it's not just droplets that are spread by coughing and then drop within 6 feet of someone, but these are so aerosolized, the particles, that they can waft in the air long distances. So someone coughs on one side of the stadium and they get measles on the other side of the stadium. COVID-19 is not that. So it's a droplet spread. I think that to recognize, too, that we have other coronaviruses. You've got SARS noted here and MERS, Middle East Respiratory Syndrome. These were not as contagious. Fortunately, this case fatality ratio for COVID-19 is lower than SARS, which was some 9.5%, or MERS, which was something like 34.5%. So that's some of the good news on it. As you can see, the fatality rate varies by country, specifically, I think, primarily due to the fact of the detection of cases to get that denominator bigger against the number of deaths. However, I think there is an exception in Hubei province, which is where Wuhan city was located, that had a higher fatality rate than other parts of China. And I think what happened there, because of being blindsided by this outbreak, it just so overwhelmed their healthcare systems. You probably saw where they built a 1,000-bedded hospital in a week, that basically people who needed care, who were severely ill, may not have received care. So there are probably more fatalities at that beginning time in Wuhan city and Hubei province that you do not see outside of China. You get an increasing number of, to recognize where it's fitting right now. Admittedly, the number of deaths are going to increase with the COVID-19, but we have to put that into perspective of, at least globally, how many people are dying every day due to tuberculosis. Or even if you look at it closer to home in the United States with influenza, some 12,000 to 60,000 people die every year in the United States from influenza, average 36,000. And so a lot of people still, even in the face of that, are not getting vaccinated for influenza, for example. We have something for that. So we have to realize, again, put these things in perspective as to risks as well. In terms of mentions in the media, as you can see, we had over 1.1 billion hits, if you will, on social media about COVID-19, whereas SARS and others are dwarfed by that. So I think that's one of the problems we also face is the outbreak of rumors as compared to facts. And I think that's something very important that just as the Director General of WHO did note that this is now being declared a pandemic, he also very clearly said we need facts, not rumors. We need solidarity, not stigma. And I think that's very important for us to realize that there's a potential for us to have issues that would not be appropriate for social justice, if you will, in this. And we need to be, again, in the UCLA community, UCLA staff, especially to recognize that we don't stigmatize people. I wanted to briefly mention the fact that we are moving now in the United States and other countries from what we call containment methods, which you've heard in the past, which is basically when you are able to find a case and you isolate that case so that they do not spread it to anyone else, and you look closely around their close contacts that have been exposed to that case, and you put them into a quarantine. It could be a modified quarantine where they just stay at home for the 14 days, monitor their temperature and for symptoms. That strategy works when you know the cases and you can then look at their close contacts. That's containment. What we're now moving towards in some places in the United States is mitigation, which means basically we're now seeing community spread. We really don't know where that case got their exposure. And therefore, you can no longer just use that containment strategy. And now what you're trying to do is look at ways that you can blunt the outbreak, reduce it. We're probably not going to be able to do like we did with SARS in 9 months, put the genie back in the bottle, so to speak. The cat is really out of the bag. So we're not going to be able to be in that scenario. But we can certainly blunt this outbreak so that rather than having it if we went business as usual, everybody handshaking and things as usual, you have a very steep outbreak going on because of the numbers of cases, which really puts a strain on our health systems as well. If we can go ahead and make it so that that outbreak becomes much more blunted, maybe it lasts longer, but what happens is that you're not stressing your healthcare system and you don't have some of the other untoward events of a very steep curve of an outbreak. Mitigation is really done on a couple of ways. One is what we do at BIS is with non-pharmaceutical interventions, NPI for short. And that's done at the personal level as well as at the community level. So at the personal level, this is exactly what Michael was mentioning today too to you about, again, the covering of the cough, making sure if you are sick that you have a mask on. It doesn't do much good for people to be wearing masks that are healthy. Frankly, you see it happening a lot, but it's not that effective. But certainly if you were self-coughing, if you were needing to go to the health center, for example, to put a mask on so that you're not exposing other people. That's an important part. Again, masks have a place in the healthcare setting when healthcare workers are working closely with patients, but there's other personal protective equipment that they are also using, and they're very trained to use it. I think also the idea of, again, the non-contact greetings that we can move to will be helpful. Again, further down, then you start talking about what can you do as a community, not just the individual. Well, in the community, you talk about things of reducing the density of interaction of persons, social distancing, and that's exactly what the UC system and UCLA has gone to with the issue of reducing the density of contact of students by going to online classrooms. And I happen to have had the pleasure of 9 o'clock this morning, having my class go online. So, it's doable, and I think we just need to also maybe even look at the silver lining in that it's going to jumpstart our faculty and students into the 21st century, certainly to be able to do online distance learning, and we'll gain from that. I think also we then could move to where if you start seeing community transmission, in a setting, that's when they've moved to things like encouraging workforces to use telecommuting, not just when you have like isolated cases again, but when you start really having major community transmission is when you want to move to some of those other measures, actually closing schools versus keeping schools open, again, at the elementary and secondary level. At a tertiary level like this, at the higher education, there will be obviously ways that you will need to continue to keep the campus operating, especially for our research that's being done. This is going to be important even for COVID-19 research that's being done. And professors can have office hours and things like this. It's just not the idea of bringing people together in a classroom. I also want to mention that there's also what you almost would call reverse isolation, in the sense that as you see that there's community transmission going on, that's, again, next step for us here in LA, is not really at this present stage of any significance, that those who are elderly and have multiple medical conditions, for example, who are in that high-risk group, they're the ones especially that need to make sure they're not going out into the large gatherings. They're not going on airplanes. They're not going on cruise ships. So I think that's something that we need to do for our own family, that we have our parents, our grandparents, et cetera, to make sure that they're aware of what would be risky behaviors on their part in the face of community transmission. And finally, just to mention, there is in disaster preparedness not only this idea of containment and mitigation, but there is a recovery phase as well, and we will get there. And so just to realize, again, just as that other ray of light of seeing that there's more recovered cases than we currently have cases of COVID-19, the fact that in China the cases are dropping markedly every day, these things show that there is life after COVID-19 and that we will get to that recovery phase. I'm confident of it. I'm especially confident because of the work that Michael Beck, other senior administrators are doing here with all the other parts of the campus, with the COVID-19 task force, our police, health centers, et cetera. We are all working together, and I think that's what's so important for staff to be supporting that effort. You're very critical for that effort, and I thank you.
Good afternoon. My name is Emily Tuntry, and I'm the Manager of Employee Relations with Campus Human Resources. This last segment of our presentation today will focus on some recent guidance that we've received from the Office of the President regarding paid leaves available for employees impacted by COVID-19, as well as telework options in relation to being ill or isolated, as well as to assist with your continuity business planning. Ideally, and hopefully some of these slides that we're providing will answer some of your more frequently asked questions, common questions that we've been receiving in employee and labor relations, and I know that Employee and Disability Management Services has been regularly fielding as well. Thank you. Please feel free to ask us any questions, call us directly in Campus Human Resources if you have any questions that we haven't answered today. If in the event that an employee is out for their own illness or to take care of a sick family member related to COVID-19, they should feel free to use all of their accrued sick leave, vacation, comp time, PTO, or other accrued leave that's available. In the event that they're out of leave, the university will provide them with up to 14 days of paid administrative leave. If for some reason we reach a point where employees are being asked to quarantine themselves or move into self-isolation, then there's the option that they may work remotely if they're in a position that is operationally feasible. And in that piece, departments will have to identify what operationally feasible is. If you're in a customer-facing role, such as a food service worker, or you're a bell attendant at the hotel, that's not an option. So departments will have to take a look at what positions can actually telecommute. If in the event that they cannot telecommute, then they can use any accrued leave available as mentioned before, and then the university will provide up to the 14 days of paid administrative leave. If we reach a point where a school or daycare is closed that's impacting employees and their children, and that requires them to stay home, then we will grant them the option to work remotely, or if need be, they can use their accrued leave balances. We've been fielding a lot of questions lately regarding telecommuting, and I want to echo VC Beck's comments that we should be all hands on deck. We really should be at work. Right now, we do not have cases on campus where anyone has contracted the virus, so we should be all hands on deck. We should be working. But as a part of your business continuity plan, considering telecommuting should be a part of the option, something that you should be examining. Which positions would fit this bill, which ones would not? Do you have the resources to actually do this? Do you have a checklist? Do you need laptops? What do you need in order to make this happen? On the CHR website, we have telecommute agreements. If you need some of this information, take a look at it. We're happy to answer any questions that you might have. If an employee is designated and has been determined that it's okay for them to work at home, they will certainly be paid for this time. Employees in positions who are unable or are not designated to work from home, but they're otherwise not able to stay at work, they may use up to 14 days of paid administrative leave for this time. In the event that we determine that some positions are designated for telecommuting, the exception here would be healthcare workers. We will certainly support the paid time away for this, the administrative paid leave. Any questions related to telecommuting for academic employees should be directed towards the academic personnel office. Erica Chow would be the best point of contact in this position. And I want to pause and say that we've received a number of questions regarding telecommuting for employees who may have compromised immune systems and requiring us to engage in the interactive process. Campus HR and Employee and Disability Management Services are in the process of developing a quick guide for supervisors on how to evaluate and review the interactive process in reviewing these requests. So more information will be coming out shortly once this has been developed, but it'll provide you with some quick resources on how to engage in the IP as well as what might be needed for telecommuting in these circumstances. Campus has a catastrophic leave program currently in place, which allows employees who have otherwise exhausted all of their available benefits, paid benefits, the opportunity to continue pay and continue their benefits. At this time, if you wish as an employee to donate to this central bank, that would be very welcome. Our balances are quite low, so whether we need it for COVID individuals or future, this would be really great and beneficial for all of us. If you would like to donate, there is a link on the presentation. You can also contact Campus Human Resources to ask any questions about this. Generally, if an employee is on a paid leave, all of their benefits will continue. Any questions about this, you can certainly contact our benefits department or UC Path. There may be certain limits or requirements that pertain to different leaves. If you're concerned at all about any provisions that may prevent somebody from having continuity of their benefits, certainly reach out to your local human resources manager, or you may contact Campus Human Resources to get clarification. Please refer to the absence from work policy when reviewing leaves that may pertain to staff employees. Reference any collective bargaining agreements for any union-covered employees. And then if academic, reference the 700 series of the Academic Personnel Manual. Here are some resources that you may need as you're going through this process. There's a staff planning for operation disruptions website. There's telecommuting guidelines, as I mentioned before. If an employee is presenting symptoms, most of us are not doctors and not in a position to evaluate what these symptoms are. Please don't diagnose your employees. Please contact the Ronald Reagan Infectious Disease Hotline instead. You may contact Disability Management Services with any questions regarding engaging in the interactive process or disability accommodation requests. Certainly you may contact myself or my office if you have any other questions related to employee and labor relations, union employees. And then if you're a health system employee, contact their HR department. The Staff and Faculty Counseling Center is a wonderful resource that we have available to all employees on campus. It's a free confidential service available between the hours of 8 and 5. All of the practitioners there are licensed, they're caring, they're wonderful, it's confidential. We offer 3 visits for free, and they may be able to refer you for more sessions to outside caregivers should you need it. I strongly recommend that if your employees are experiencing any distress, anxiety over watching the media, any of the news coverage, any of the announcements that are going out, I know they're coming kind of fast and furious and information is changing daily. It's important to take some self-care and just pause. And the more we're in control of our own actions and thoughts, the better off we all are. But utilizing this resource is really great. If you need them to come out and present in your departments, please ask them directly to do so, and they would be willing. That's the end of our presentation. If you give us a few moments, we'll open it up for questions and answers. Thank you.
Good afternoon. My name is Anthony Solon. I'm the Director of Employee and Labor Relations for the UCLA campus, and we actually already have some questions that we received online. Obviously, we'll also open it up to questions from the floor, from the audience. But before I begin, I just wanted to emphasize, at least personally, thank you for everything you're doing. The staff, I consider, are, in many ways, the backbone of our wonderful institution. We're integral members of this community, and I see many familiar faces in this room, and I know how hard all of you have been working. Many are maybe operating on a couple of hours of sleep, and that's not only because it's our job, but because we deeply care about our students, our faculty, the academic and community mission of this organization, and frankly, each other. And I am confident that we will get through this. It will be difficult, but we will get through this. We have approximately over 30 minutes or so for questions and answers. And before I dive into the first questions that we did receive, I also want to plug yet again, right now, one of the wonderful benefits that we have is our catastrophic leave program. Please call our office. The information is in the PowerPoint. If you're willing to donate some hours from your vacation bank so we can make it available for, frankly, members of our community that are going through some tragedies. Hopefully, it's not something that we want folks to actually be in a position to actually utilize, but if they need it, it's something that we want to make available. So I highly encourage donations to that program. The first question, and maybe Michael, I might ask you to weigh in on this, is why 100 people or less when it only takes one person to transmit COVID-19? Why was it capped at 100 in terms of meetings and events?
So that's are we on? Okay. So that's a difficult question to answer, except for the fact that the goal of what we're trying to do is reduce the number of contacts individuals have. So again, reduce the density of the campus. And it's not possible to eliminate all activities on the campus. other campuses, Stanford used 150, I believe Berkeley used 150, UC Riverside used 100. It's a number that folks are using. What's interesting, if you look at the CDC, the LA County Department of Public, or sorry, too many health departments, the California Department of Public Health, when they put out their guidelines associated with eliminating events because of community spread, when you have more than 5 community spread patients in the county, they're actually using a number of 50. But we're not at that point at this time. Like I said, we have 0 on the campus, and the intent is to keep it that way. And so it's trying to find the right balance between not having too many people on the campus, but recognizing the fact that we still have to operate. And I don't know if Professor...
Yeah, that seems it's somewhat arbitrary number, but I think it makes reasonable sense in what's being done in terms of titering it based upon what's happening in the community at large.
Dr. Kim Farley, I'm going to ask this question for you, is once an individual has recovered from COVID-19, can he or she be reinfected?
You know, it's a very good question. Actually, hello, test. Sorry about that. My fault. Thanking you. It's a good question about whether there is immunity following COVID-19 infection, and if so, how long would it even last? So that's one of the things that scientists are certainly looking at the moment.
Any questions from the audience? I just don't want to make this exclusive to our online community. The gentleman in the back, and I'm going to try to repeat the question. Oh, there's a microphone, which is great.
My question's for Dr. Kim Farley. I read online on CNN from Michael Osterholm. He stated that, you know, a lot of people are expecting this crisis to end, you know, similarly to the influenza, the flu season, quote unquote. Do you feel this is going to end soon, or is this something that can last even through summer season?
Thank you for the question. There is some suggestion that coronaviruses are susceptible to heat, and that like we have an influenza season, it may drop in summertime. It's not certain yet. We'll have to see what happens. I'm also reminded, of course, half of the world, our summer is their winter. So, you know, we may see actually things happening in the southern hemisphere. Also, when you have a new disease like this where there's very little immunity in the population, sometimes you can still see transmission occurring and cases still occurring even in the summertime because there's just so many easy access to people that it can grow in. My own sense is that we're beyond that containment in the world like SARS, to get it back into the bag. I think we're in the phase right now of what I call fits and starts, whereby you have like almost a matchbox and you're throwing matches into the forest, and some of them are, you know, taking hold and having little forest fires. I'm actually more concerned. We're hearing about these situations in developed countries, and that's primarily because they have testing, fairly robust testing going on. I'm more concerned about like the Lagos, Nigeria, a developing country, heavily populated, densely populated, a challenged already healthcare system. We'll probably see some explosive outbreaks in some of those countries. It's conceivable in my mind that we actually might end up in terms of the long-term scenario of this becoming an endemic disease. It will be with us. It will wax and wane, perhaps with seasonality. And until we have something like a vaccine, which is probably still year to year and a half away, it may still be with us. We may at that time be able to talk about taking it out.
Another question, and Doctor, you're popular, so I'm going to go back to you. But if anybody on the panel wants to weigh in, there is an HR component to this, so we'll weigh in as well. What should departments do if we have an employee who is coughing and sneezing, but claims that it's due to allergies?
Yes, it should be evaluated by a physician, because I think at this stage, I'll defer to HR, but if someone has symptoms that are potentially an infectious disease, I believe that has to be investigated. But you would Okay, urgent.
Yes, anyone who is ill, we recommend strongly that they stay home. That's just a general recommendation. And I know people want to come to work to get things done and to be with their colleagues, but we strongly recommend that if anyone has any symptoms, whether it's the basic flu or other conditions, that they should stay home. Allergies are a little bit different. People go to doctors and get medications for that, but we do encourage that if they're having a serious allergy attack, that they also stay home and take some sick leave.
But the scenario, say it escalates or you seriously think that they have a fever, they may be contagious. We're getting a lot of these type of questions, obviously, given the heightened anxiety that we have. That's where you pick up the phone, consult with our office. We're not doctors, but in terms from an HR perspective, in essence, can we send somebody home? The answer technically is essentially yes, but we want to have a discussion with you before that. Hopefully it doesn't come to that. But more importantly, we want to make sure that they see a medical professional or that we engage with medical professionals before making that determination. So a lot of it, unfortunately, is going to be case by case. And I should have prefaced this segment is a lot of this, it's a fluid situation, it's evolving. We're a big, complex university and campus with many, very diverse operations. So unfortunately, some of these answers will have to be case by case, and the guidance that we've been provided by the Office of the President is exactly that guidance that we will have to fit within the specific scenarios that we are already experiencing and will continue to experience throughout this process. Any questions from the audience before I go back online? Yes.
We rely on student staff tremendously. They're kind of like the hidden workforce that actually keeps this operation going, the university. While I'm hearing an all hands on deck, i.e. come to work framework for full-time staff, or I'll use that terminology, when it comes to our student staff who are filling in these spaces, who often fulfill vital functions, the message they're receiving is, if you have any concern, don't come to work. So as far as departments having to manage continuity, I think there's going to be, hopefully it won't work out this way, but I think there'll be some stress. We may find ourselves in a situation where we really can't say, come to work, when they're getting a message that if you don't feel safe coming to work, don't come to work, and then we might have to reduce hours or make adjustments based on that workforce issue. So I want to know if there's any other clarification, or did I kind of capture what our policy is?
And that's a great question, and we received several questions online about this. And in fact, it came up on the task force in terms of a call that we received and in subsequent emails. It's something that we're actively looking into in terms of the utilization of our students who will not leave campus and want to continue to work, and they can work. Michael, I don't know if you want to elaborate on that, or Luby.
Hard to say that we're still trying to work out the details. Many of our students are on work study, and so they're actually required to work to receive their financial aid to cover the costs of the university, attending the university. And so it's likely that you will still have a number of students that will be continuing to come to be able to be eligible for that funding. And we're also looking now at what the implications of moving to non-in-person classes.
Question that we received online is suppose that a supervisor does not think that their staff should be able to work remotely. Who should we escalate these issues to? What I will say is, and what was stated before, we are in an all-hands-on-deck situation. We have not closed the campus. The campus is safe. We can come to work, but my understanding is that the reason why the measures that have been taken is as a preventative measure. And ultimately, the decision is up to the department whether they can accommodate telecommuting requests. If you want to reach out to my office at Employee and Labor Relations, if you have any questions, we do have a wonderful staff of employee relations consultants who can discuss the policy with you further. And we can discuss that on your specific situation. Any questions from the audience? Another theme that I'm seeing in terms of questions is, in essence, which I think I probably may have answered, but I would love the panel to weigh in, is in essence, students are being encouraged to leave the campus or not to congregate in large numbers, but we are in an all-hands-on-deck situation, and the staff is being asked to come to work in order to run the day-to-day operations of the university. Isn't that incongruous? Again, from my understanding of Michael or Libby or my panelists, I would love for you to weigh in, is in essence the campus is safe. It was a preventative measure. We still have to service our wonderful university and our community and support each other.
I would say we reduced the risk of spread on the campus simply by undertaking the actions that we did, by moving to distance learning and having many of those students, literally will be thousands of students relocating off of the campus and tens of thousands of students not attending classes on campus, significantly reduces the risk for everybody who's still here working. And so one of the things that we continue to recommend is that you try to limit the contact that you have with individuals, particularly those that might be symptomatic. And it doesn't mean that we shouldn't have meetings, but if it can be put online or a telephone call, as much as we enjoy and appreciate those interpersonal or those direct contacts, this might be a time in which we pull that back a bit. And when we do have interactions, is maybe have a little more distance than we normally would, just to be respectful of your colleagues.
Yes, and I think this meeting itself is a prime example of how that is working, so that many are attending remotely. Also, again, I think the difference between staff is that they are not in settings with hundreds of students, congregated in the same room. So the work environment is different than in the classroom environment.
One question, I actually see a colleague from facilities management here, so I won't put you on the spot, but hopefully if I put my foot in my mouth, somebody will help me here. Are all UCLA offices being thoroughly disinfected, and how often? My understanding is the focus of our incredibly hardworking colleagues at facilities in similarly situated departments is they're focused on high-touch areas, right? But I don't know, Michael, if you want to elaborate further, or Zandy, if you want to elaborate further on what's going on.
Yeah, the focus is on our high-touch areas, and it was in our classrooms and still is, as Mr. Michael Beck mentioned, they're still being used. Our restrooms, and the possibility of disinfecting every office on campus every night is not really within our grasp right now. We're working on securing the materials to do that, but we are focused on the high-touch areas that are shared communally and making sure that we have the materials to wash everyone's hands in a healthy and safe restroom.
I think this is an opportunity where we can all support that. So potentially even bringing in Clorox or other wipes that you might have already acquired or have in your office, and wipe off door handles and your telephone and even your iPhone or phone device. This is probably the most contaminated device that we have because our fingers are constantly on it. It's up against our face. This is something that you should be wiping regularly.
A question that probably a lot of us have on our minds, because of course we have grandparents or dear loved ones who are elderly, is general advice on caring for elderly family, and specifically in the context, and I heard it in terms of avoiding large groups, travel, things of that sort. Dr. Kimfarley, do you want to elaborate further on what we can do to support the older members of our families and loved ones?
Yeah, so again, if you've been exposed to something like that, you should not be going into their presence with the potential for spreading to them. Also, it's been recommended that those who are caring for elderly, if we can limit that to one family member so that not multiple family members are seeing them, that increases the chance that one might have been exposed and could be exposing the person who is at high risk and elderly with comorbid conditions.
Another question regarding our facilities. What is the policy, or has there been any determination regarding the use of our gyms on campus? And I would imagine locker rooms and things of that sort. Is there any limitation?
So we have some of our colleagues from Student Affairs. I might defer to AVC Mick DeLuca with regard to the gym. We have talked about potentially reducing the occupancies and loads, and so that's something that we may be, that they may be looking at as well. So for instance, the computer labs are still open on campus, but we're going to implement a reduced occupancy load, so they won't be, so full will be less than normally full. And Mick, I'm not sure if you're anticipating the same occupancy reductions.
Yes, all the work out in gym facilities have gone into a deep cleaning protocol, similar to what was mentioned in the high touch, but with the day-to-day staff doing multiple wipe downs of equipment, handles, and the like. As we move through the spring break period into the start of the quarter, probably will be utilized more in an independent exercise versus group activities. And then once we get to some clearance point, might resume what might be formal group activities. So that staff is actually meeting as we speak right now, but those facilities will be in operation with a number of these protocols in place on a daily basis.
Any questions from the audience? No? Then I'll go to the online questions. Interesting question. Is there an expiration date, time period for the additional 14 days of administrative leave that's contained in the guidance that we received from the Office of the President? I don't see it. I imagine, well, not imagine, the thrust of this was to get us through this time period. So I don't know, Luby, if there was any overarching policy discussion, but my understanding is that the purpose of these guidance is to get us through this time period of if staff members are impacted and, for example, need to quarantine from home and they don't have enough time on their leave banks.
Yes, I think you're right, Anthony. The 14 days does not have a time limit, but I'm sure as time goes by over the next several weeks, we'll be getting additional information. If that needs to be extended, I'm sure questions will come up and we'll get some additional guidance.
Interesting question. I don't know, Michael, if you're able to answer this one. Is UCLA doing any health outreach to homeless individuals in our community to prevent community spread?
It's actually a great question, and it's unfortunate the School of Nursing actually had an outreach program scheduled, I believe it was for this week, to the homeless community, and it was determined that they actually needed to cancel that event. And so I'm not aware of other programs that we're doing different than what we're currently doing, but that's certainly a population at risk, and at the moment we still need to understand and make sure that we're not putting our own employees or our own students at additional risk.
Any questions from the audience? No? Okay. The next question is, again, a good question because it's come up a lot. And again, I don't want to understate the level of anxiety that unfortunately, understandably, our colleagues are experiencing. Again, I cannot overstate the wonderful role of our esteemed colleagues at the Staff Faculty Counseling Center. Please reach out. Frankly, I have no idea how you do what you do every day, given the, and I can only imagine the volume of cases that you're getting currently. But in essence, if an employee doesn't want to come to work and it's not related because they suspect that they got infected or they have a close family member or a school shut down, but in essence, they're just scared and they don't want to come to work. And say, I'll add a little bit, say their job is not one that could easily be done or cannot be done remotely. Again, the campus is open, it's safe, the expectation is to come to work. But again, you know, from my perspective, we need to be supportive of all members of our community. I would want to have a conversation with that individual as a supervisor and understand the concerns and see how we can support both them and frankly our colleagues through this very difficult time. I don't know, Emily or Luby or anybody else wants to add to that?
Yes, I think it's clear that many of us, if not all of us, have anxiety and concern during this period. I think the uncertainty is a major stress point. So to the extent that we all feel that we have things we can do to help the situation, that's positive. And I do agree that our Staff and Faculty Counseling Center, which always does a wonderful job meeting with individuals as well as groups, is something that employees who are feeling anxious or scared would want to take advantage of. So I would encourage that a great deal. Emily, did you?
The only other thing I would offer, in addition to what Luby and Anthony have already shared, is that if there's some underlying medical reason that's causing them concern from coming in, then they should coordinate with our office or the Office of Employee and Disability Management Services. So we've been receiving a number of questions in that regard. So if, as a supervisor, you're fielding this, or an HR manager, you're fielding it, please continue to seek guidance on how best to support the employee in that vein.
Another question about our staff colleagues is there a difference, in essence, in the types of support that are being offered between hourly and salaried staff? I'm not seeing it in terms of the leave guidance that we've been offered or provided by the Office of the President. Obviously, the Staff Faculty Counseling Center is open to all staff. My office is available to all staff members. I don't know if there's any other elaboration on there, but again, we're all members of our community and we'll support each other as best as we can. Again, there will be very unique situations. We have a big and complex operation, and some things will have to be handled case by case. And if you see me going through the cards, it's because there's a lot of repeat questions, so I'm trying to hit the large themes that I'm seeing. Any other questions? Let me get you the mic. No, we need the mic for our folks, for our colleagues online.
Thank you. It's hard to get supplies, so, people can't get sanitizers, cleaning products. We're backlogged in our office to be able to get it. Any suggestions about, is UCLA going to have any easier way of getting access? And my other question is are the people in the hospital getting enough supplies to protect them?
So great questions. I'll start with the last piece first, and that's that we do have a significant emergency supply for the hospital and for the campus. Of course, the primary purpose and use, or the priority, is for hospital and ASH, and so that's where the supplies that we have associated with masks and gloves and other protective equipment, as well as any of the sanitization stations, that's the prioritization. We are having difficulty. This is a significant supply chain issue. Even the wipes that I mentioned earlier were very difficult to obtain, but we did obtain a large quantity that would sustain us for a number of months and would be able to be supported in all of the classrooms and the library facilities. If you have a specific need and you have a larger office environment, because these are industrial containers, so check with facilities management. But again, we want to, I wouldn't say rationing is the right word, but we are trying to be sort of appropriate in the way in which they're distributed, because we're not sure when the supply chains will resume, and we need to make sure that we have supplies for the hospital and medical operations.
This question is for Dr. McFarley. It's perplexing, talking about supplies, the run on toilet tissue and people's anxieties about obtaining seemingly huge amounts of it. From the public health perspective, maybe you can explain what that is, or maybe it's a social panic reaction to media on this issue.
I think it really is more of the social anxiety and concern, just like also you see it with water. I mean, there's no reason to expect that our water supply is going to stop in Los Angeles. It's good to have for earthquake, these things, because oftentimes we try to get people to have, at least 3 days supply. So for that purposes, it's good. But I think that people are being concerned. I don't anticipate that supply channels, like for being able to order online and get things, those things should be able to continue even in the face of community spread going on.
I'm sure a lot of us have had the experience of going to Costco or Target or any other And it's almost like you feel like you're in a bit of a movie, right, when there's no supplies. Interesting question. For educational programs for the public, should we move to online only? There's no other context. But again, I think generally speaking, the 100 or less in terms of meeting, again, just as a preventative measure. I know personally I was actually supposed to do a training this week, but I saw the count was about 150, so I'm looking to move it to an online platform or a medium in order to, I would feel horrible if by conducting a training somebody got sick because of that. And again, I think the whole point of this is to prevent, not that we have any active cases on the campus. The campus is safe, but we are trying to limit the potential exposure. I don't know if there's any other elaboration on that point. Just quick time check. We have just a little over 10 minutes for questions and answers. I've pretty much been through the cards. Again, the big themes of safety, potential resources for staff is the ones that we're seeing a lot of. Any other questions that you may have? Yes?
I received one by email.
Okay, go ahead.
And maybe this is more for Michael. Do you know if the university will be in a position to financially assist students who must go home, but whose inability to perform their student job will cause a considerable loss of income for them?
Karen, you want to field that? I mean, we have an emergency fund for students, and I would say if a student finds himself in that situation, they should contact Thank you, Economic Crisis Response Team, and have them assist the student in that way.
Are those students being forced to go home?
Yeah. Oh, I'm sorry. Yeah, that's a great clarification. Nobody's being forced to go home. It's a choice of the students to leave the dorms, the eating facilities. They're going to remain open this week through spring break and into the beginning of spring quarter. And in fact, normally we don't have food service available during spring break, and we are going to actually have one of the food service available for 2 meals a day, one of the to-go venues, partly because there's international students that cannot go home or worry that if they do go home, they may not be able to come back for spring quarter. And so remember, when we normally house about 20,000 students on this campus, and so I expect a significant number of them to go home. This is the home for many of our students, and so they will continue to be here and we'll continue to support their needs.
Another question which I think, again, we should emphasize is essentially if an employee brings a doctor's note that they're sick, what should we do? Well, honor it, simply, right? Again, our AVCs and several of the panel members and I support this. If somebody is sick, stay home. We want to encourage that. I understand that sometimes that will at times hinder some operations, but again, especially given the current situation that we're in, if somebody's not feeling, whether it's COVID-19 related or not, we want individuals that are not feeling well to focus on their recovery and their health and hopefully rejoin us when they feel better.
Actually, a thought that came to mind as I was talking about the dorms and housing facilities that are available, our ECE, our early child education programs are also going to remain open, recognizing the fact that they serve our faculty and staff primarily, and many of them within the health enterprise. So again, those programs are going to still be here to support the campus community.
Maybe a question that I'll ask the panel, I'm going to ask you to use your crystal balls. Looking into it, where do we think this is headed in terms of ultimately when are we going to pull out of this? Any sense of, just based on the experience in China, what we're seeing in Italy, now what we're seeing here in the United States and around the world, any sense of any predictions of when we're going to see the other end of this?
I did mention, again, the 3 scenarios in a sense of, containing it, which isn't going to be happening, obviously, the idea of the fits and starts going on around the world, and then the final one, maybe that's potentially setting in as an endemic disease until we actually have vaccines and other treatment modalities for it. So my sense is that we're right at the beginning here in Los Angeles. We have the 27 cases. We've had a couple of them now, looks like community transmission. But I think with 11 million people in the county, we should be expecting the fact that these numbers are going to increase. And so therefore, once we turn the corner like China has done, where they're now starting to reopen businesses and things like that, that's when we'll be able to start going back to more business as usual. But even still, I would imagine for a while that we'll be continuing to need to do some of the social distancing, especially from the personal level. We may actually need to change those habits permanently.
Somewhat related question is, why is the death rate in the United States so high compared to many other countries?
I think the issue there is, again, this somewhat artifactual aspect that those who had severe disease were coming to hospital and settings, and the ones with limited testing that we had were the ones being tested. And so the number of other people who had more milder diseases, the testing wasn't really being conducted. We are now with some 1.5 million test kits out there. We'll see that rapidly. I think the number of cases will increase much faster than the number of deaths increasing, and so we'll see that case fatality ratio dropping.
Is it also coincidental because it really started in the nursing home?
Well, that's Vice Senator Beck brings up a good point that, in a sense, one of the canaries in the mine was that recognized we have some real problem here in the United States was in Washington, in the nursing home, the elderly that it got into. A lot of people died, and so that was a particularly unusual setting to happen at very early on, which would have driven up the case fatality rate as well. Good point.
And I think this will be the last question before we have, oh, go, why don't you go ahead? Let's get you.
Thank you. We have a lot of commuters who travel to work via train, bus, van pool, places where there are a lot of people. Are they at higher risk for contracting the virus? And if so, do we have any special advice for them?
I think one of the things to realize, again, that on like airplanes, buses, et cetera, what you can do, at least for your own personal space, have wipe, let's say, for the armrests or tray tables or things like this that exist. Try again to avoid from touching surfaces into your eyes or mouth. If someone is actually, coughing and not covering up, you should be asking them, please, we have to be careful, or moving away from them. So I think that's what you can do on these public conveyances.
And the last question, and before maybe some closing remarks, can you speak more about what will happen on April 11th? When can we expect another announcement on when in essence, the current time period that we're in terms of online courses for our students and lowering the population as a preventative measure here on the campus?
Recognizing the significant disruption that would occur for us to bring everybody back to campus and bring classes back into the learning back into the classroom, we'll be making those decisions as far ahead of the time frame that we can. I can't predict ultimately when we will determine whether or not there's an extension of the time frame or whether or not we'll be able to resume in-person classes on the 11th. So I would say just continue to look toward the Bruin Post for that, but we'll do our best to give as much notice as we can. And I think we should also contemplate the possibility that there will be an extension to the distance learning objective that we've already pushed out at the time. If you look at the growth curve, as Professor mentioned, we're in the very early stages of the growth, and so I anticipate that it'll get a little bit worse before it gets better. And I would say so we need to be prepared for that, but we will provide ample notice to students and to faculty and staff to be able to prepare for returning to a campus normal operation.
Anthony, we've received another question from a viewer. Can Campus Human Resources send an email communication to all staff as a reminder that they should not come to work if they have a fever, cough, etc.? So there are many people that aren't viewing this presentation.
I see. Yeah, I know there's a lot of communications going out, so obviously I would discuss that with you, Libby.
Yes, excuse me. We're actually developing a memo that will go to staff covering a lot of different issues so that if anyone has missed this session or needs additional information, we'll have the resources for you. And I think that type of a reminder would be valuable, so we'll be sure to include that.
Great. Michael?
I was going to say, and that's one of the reasons why the Office of the President added the 14 days of additional leave if individuals are out of their leave bank, because there are individuals who unfortunately have become ill and have been able to and don't have a current leave bank, and so they're sort of forced to come to work in an effort to make sure that they get full compensation. And so the intent was to make sure that there was a pool that they could go to make sure that they have the opportunity to stay home and not have to take an economic reduction as a result of that. And so we have been including the message in almost all of our Bruin posts, and as Luby mentioned, we'll actually have another one coming out specifically toward staff and dealing with these issues, and we can take a little bit stronger stance on having people stay home when they're ill, because that's the best thing you can do for yourself and the best thing you can do for your colleagues.
And we have reached 3:30. Any closing remarks? Does anybody want to have any closing remarks?
I just would, again, like to mention that we at UCLA can be calming for our communities, and when we go back to our communities as well with the information that we have, power is in the information, and to be able to project a calmness about this, the recognition that this is a disease that we will ultimately overcome, and that through solidarity we can mitigate the the effects of it.
I just wanted to thank all of our speakers and thank all of you, both those who are here in person and online. The questions were excellent. We really appreciate your participation, and thank you for joining us.
And last thing, thank you for everything you're doing to support our community. I know these are challenging and trying times, and I'm confident that we'll get through it together. Thank you.